You mentioned it before, using telemedicine services to talk to your patients. How might that pose kind of a new threat or a new problem for burnout?
Yeah. I think most of the folks I'm talking to, physicians that I'm talking to, and teams I'm talking to, and in my own practice, I'm experiencing this myself, is it's a very double-edged sword. And until we learn, how to take advantage of the advantages and manage the challenges, it's going to be anxiety provoking. I think the biggest problem or the biggest fear on telemedicine is the demand on time, because now it's not simply me going to the office and you're scheduled and I see you. Now it can happen anytime. Patients have access to me. I have to access them. They come to me in my home where I am right now. I go to them in their home. So that is the big worry. That has to be managed, okay? But the flip side of that is flexibility, okay? Now I can actually schedule my visits in between bathroom breaks or in between some interaction with the family or doing something else that's in my home that I need to do to take care of my own life, between exercise. And so I actually may have more time to do this. Now suddenly I'm making home visits and learning a lot more about my patients. Instead of having them coming in and telling me this is going on and not really knowing that. It's actually like in the old days when I actually used to actually do regular home visits, and I'd see what's happening there and could help them better with their safety issues, with their behavior and lifestyle, with their social issues in those areas. Now suddenly I'm in their home. We know that the determinants of most health, chronic illness, for example, are underlying lifestyle, the things that impact the bread and butter of what goes on in chronic disease, heart disease, diabetes, obesity, hypertension, et cetera. 60 to 70% of these have to do with behavior. It's not simply about pills and procedures, or the social determinants of health, the poverty, the stresses that go on. Suddenly, we're out of the office in their homes. And so there's an opportunity, if we'll take the flexibility, to actually more thoroughly and more holistically evaluate and care for our patients than we used to. And so threats by demand on our time, but flexibility on the other hand. And I think where it pans out depends on how we manage it.